We're starting very soon, and thanks for being on the call. We're starting in a moment. Any moment from now, we are going to be starting. So, Dr. Chris, are you there? So, we will be starting in 3 minutes. 3 minutes from now, we're going to be starting. So, we'll be starting in about 2 minutes. Okay, so we're starting in 15 seconds. 10, 9, Eight. Welcome, Dr. Chris. We're starting in 7 seconds.
I can hear you.
We are starting in 5 seconds. Can you hear me?
Yeah, I can hear you.
Yeah, so we are starting in 4 seconds.
Okay.
Three, two, one, and I think we're ready to go.
Okay.
Before we start, can you also do you see if you can access live directly on YouTube or on the website, the link that I just posted? Um if there are any listeners, then we could just do a 5 minute delay so you can check that. We'll be doing directly via the live call, but it's just to check to see that it's working well.
let me get into the YouTube and see if it actually goes live.
Okay, another way to access this could be Basdeck. Let me send you a link right now to see. There's a second way you can access this. Basdeck, cmrc.org/live. So we want to see all the methods are available. So when our viewers come, then we can add them on the call.
Okay. Have you sent the link? Yeah.
Yes, I've sent the link.
Yeah. Um, I think I'm there also.
Okay. Uh, you should normally be able to listen, and I think when from the website, can you listen? Can you hear the call?
How can let me see.
Yes, I think you need to click on the play button. I just tried to click it myself, and I think it is active. Yes, it is active. I think you should be able to also join via live call, but that will not be necessary. But we're just testing so that eventually, when any participants come, this call was done with a very little notice, so nobody knows about it. So we're mostly looking at the fact that we'll be recording the call. We're recording the call for later on, so that people can watch
Okay.
the call later on.
Okay. No problem with that.
Yeah. So I just wanted you to see whether you can also join the live call like a video.
I think I've joined and you can see me now there.
I don't see you. Yeah, right now you're on WhatsApp. And, I don't see you on the video on the YouTube call. Or am I doing something wrong?
Because let me send you a screenshot. I'm there.
Okay. Okay. Let me open the screenshot. Uh, s- 1 second. Okay, yes, this one is not joining the call. I think this is just being able to view like a viewer, not like a presenter. But just in 1 minute more, I'm just looking for the record button so that I can record the audio version of the call in high quality. Once I find that, then I think we can start. Also, you can also promote as well by sharing the link or the banner, the links to some interested participants. I'm just trying
Yeah.
to find the record button. Okay, I found the software. So I think in 2 minutes more. I'm going to hit the record button, and then we'll be able to
Okay,
start.
but I can actually see you.
Yes, I know.
Right?
I know you can see me. The question is if you can also like stream, because I'm the one streaming now through the YouTube channel. Add stream. Okay. Yeah, the question is if you can be able to stream from there as well, like the presenter, because you're the host. That's what I mean. It shows one viewer right now. Shows one viewer.
I'm trying to look for option, but I think I'm not seeing the option here.
Okay. Okay, I'm about to start recording. New audio recording. Okay, so we're ready to go. You can proceed with the questions.
Okay, I think this interview is more on the digital health solutions. Uh, I think I'm getting the right record from the YouTube, so it seems like it's echoing
From my end or from your end?
from my end now.
Then you should mute from your end because I'm going to record from my end.
Okay, okay, you can hear me now again.
Yeah, I can hear you, but I don't know if it's recording clear enough. But I just hope so because it's really low. But if you also have a recording device, you could record from your end. But I'm recording from my end. Mine is very clear because I have the mic here. So uh,
I think I don't have a recording device here, but let's just hope. I'm thinking that it's going to be okay from that angle.
speak now. Let me hear. Let me see how effect. Go ahead.
Okay, like I said, we are doing actually. I think you can hear me from there.
I can hear you. Yeah, go ahead.
Okay, so um, basically, I have some few questions I'm going to ask in respect to that. And in terms of the healthcare
For
application,
can you wait for a second? I would like to see if I can put you on a really loud speaker because it might the viewers later might not be able to get what you say. So just give me a second. Let me see
okay,
if I can put you
okay.
on a loudspeaker.
Is it okay now?
No, just it's going to take a minute. I want to connect you to a loudspeaker to a woofer so that it's going to record
Okay,
it
no
to the.
problem with that.
Okay.
The Bluetooth device is ready to pair.
Okay.
Connected.
Okay. We have two viewers. Can you speak now? Hello?
Okay, I can you hear me now clearly?
No, I can't hear you clearly. Let me see. I've just connected, but I don't still. 1 second. Let me.
Disconnected.
I'm going to.
Connected.
Yeah, speak now. Let me see.
Hello, can you hear me?
Let me drop the call and call you back. Let me drop the call. Uh, Hello. If you're listening, just wait for a moment. We are working on some quality issues. We are going to handle it in a moment. Okay. Hello.
Can you hear me now?
Yeah, let's just go ahead. I've always been able to hear you clearly. It just happens that it's not echoing loud enough. I don't think the listeners are hearing, but I'm going to repeat the questions that you're going to ask just in case the listeners cannot hear. So you can go ahead right now.
Okay, like I was over there. I said, I know you have a healthcare application, and you know, anyhow, Mr. Henry, I want you to explain to me how your new healthcare application works. Like, how does it work?
Yeah, so in this call, we are talking specifically about maybe one of the healthcare applications. And this application is designed to help people, both people like individuals, doctors, nurses, pharmacists, and the patients. So it is not designed to sort of like consult from the perspective of like consulting directly, that is designed to bring together the healthcare practitioners and the patients. So how does it work? Imagine imagine you are a patient and you have some symptoms. You view an advert saying, "Oh, are you having these chronic problems? Are you having such and such health problem?" Uh, here are some health tips. So you wanting to get these free health tips, maybe you've been having a back pain, or you're a lady on maternity, you're pregnant, you want to you like to get these free health tips from somebody. So you go to the application, which is free. By the way, this is free for the users, the patients. And what this application does is it connects them to a healthcare practitioner who is closer to their location. So the healthcare practitioner could be a doctor, it could be a nurse, it could be a pharmacy. It matches up the patient with the right healthcare practitioner based on the proximity of the location. That is, so it creates a match between the healthcare practitioner and the proximity to the location. So I think that's the basic idea of how the application works. So the doctors, the nurses, and the pharmacists are in the platform. I don't know if that answers the question.
Yeah, I think he actually answers the question. I think is a great feedback because it's interwoven and it brings a lot of people together, which makes it actually good. Um, it's an interesting idea, and but I still want to ask a question, which is, can anyone use it, or is it for specific people? Because that was what was running in my mind. But can anyone use it, or is it for specific people?
Okay, so the question is if anybody can use it or it is for specific people. So it is available for anyone. So from the patient perspective, anybody could use it. From the doctor or healthcare provider perspective, they have to be registered in the system. We need to get their license. I'm sure these are registered healthcare practitioners who are going to provide the right care to the patients in need. So we ourselves are operating uh, through a partnership with several registered healthcare organizations, while we are also registered as a digital solutions provider and a project facilitating and consulting company.
Okay, yeah, I get that. As you rightly said, this application is for doctors, nurses, pharmacists, and even individuals. So, another question I'm going to ask is it like, do they pay monthly or per use?
Yes, so you're asking if the doctors pay monthly or the patients pay monthly or pay use. Are you asking the doctors are paying monthly or the patients are paying monthly? Which of the sites?
Um, the patients. Are they paying monthly or per use?
So the patients are having free. The patients have free access only when they get in and when they speak service. That's when they have to pay a certain premium, which they could pay directly to the doctor, or they could go and meet the doctor physically. Since the application works on proximity by bringing the patients to the doctors, that's those in close proximity. So it is designed to be free for the patient until when they start receiving services from the doctor. Why the doctors are able to pay per use, the doctors are able to pay to get in and use it for the day or to use it, offer a service for the week, or based on the agreement they have with us, the service provider. So the healthcare providers listening always have to contact us to be able to get a deal.
So at this point, the application is just a midpoint. It's a midpoint for all these people mentioned: the doctors, the nurses, the pharmacists, or the individuals. Whereas for the individual, which I think is the patient, it's only part where he or she pays is when he has had a doctor and he wants a service to be provided for him or her.
Yes, you're right. So the only time the patient pays is when he has spoken with a doctor or a healthcare practitioner, and they are in proximity, or they can offer them what they want, then they negotiate a fair rate, or they physically go and meet the healthcare provider, or maybe if they just need something remotely, or they need some vitamins, they need some supplements, the healthcare provider could provide what they need.
Okay, that makes it even more sensible. Um, um, Going through, I realized that you have other applications in the health field. How does it fit in with this consultation applications? You also have source test strip supplies. How does this fit in? How does it actually fit in?
Yeah, so we have other. It's true, we have other uh, products, but we are an integrated solutions provider. So what we are doing is we are helping these clinics for to have integrated solutions. Like we have inventory management. Uh, so we also help them to source their supplies from ISO uh, verified suppliers. So we are providing them an integrated solution, not just one solution, because the clinics need to have they need to purchase supplies, they need to purchase test strips, they need solutions to manage their inventory, they need solutions to procure other products. So we have other solutions which fit per niche, and they could also need external paramedic services when their own paramedic department is not available. They could need other external paramedic services, maybe to pick up patients, to drop off patients. And so we try to provide integrated solutions to the healthcare uh, companies we work with and to the clinics we work with.
Okay, interesting. You made mention of parametric services. Are these parametric services on the app?
The paramedic services are on the application as well. So when the user comes to the application, they are able to request a paramedic service. Maybe they are able to request, we want a pickup or we want a lift. We want you to deliver us in this place. We have a patient. We would like you to pick up the patient from here. So all of this is in the application. So I might be interrupted for a second because it seems like somebody is trying to join the call. I want to see if I can get them in. Just give me a moment. I'm looking at. Uh, Hello.
Yeah, I can hear you.
Yes, I was
Yeah,
trying to.
just go
Somebody
ahead.
was trying to join the call. Yes. So I don't know if I answered your question.
Yeah, yeah, absolutely. You answered the question, and I think that we can maybe move on to the next question, which I thought I could ask. So the question was, how can they get access to this app?
Yeah, so for the users to gain access to this application, they will be able to download it. They'll have to contact us. They'll have to write to the BASTEC and ask request for the application, because we are giving it to a very few set of people now, since it's still in the beta mode. For the healthcare practitioners, they need to get to us as well. They can get to us through the BASTEC site, or they can get to me personally through my number. So that's just how they can get to the application. But in due time, it's going to be available for downloads on the Play Store and the Apple Store.
Okay, so for the meantime, it's through the website and your number. It means you need to make this. I think you already made the number available.
Yes, anybody who needs the application is going to get the application, because we are available on so many channels, including a Facebook page. And whoever listening to this call, wherever you're listening to the call, you can just comment and say, "How do I get access to this application?" And if you're going to use it, then we are going to deploy the application. If you're a clinic, we'll deploy it on your platforms, and we are going to negotiate, and you'll be able to have access to the platform.
Okay, so everybody now you heard what he said. He's available on Facebook, on his number. So you're probably going to get to him if you want the app. At the moment, like you said, is is a long term project, and very soon it'll be available on Play Store, where maybe you don't even have to get to the very area, just download. And if you need other services, then you can actually get those numbers which you mentioned on the social media applications. Uh, that's it. So, Mr. Henry, I think you have a finance and investing background. How do you see this fitting in your healthcare application?
Yes, our healthcare application is an integrated solution, as I said. And me coming from a finance and investment background, I see this as a very good investment for health, for clinics, because it's going to help them to reduce lots of their costs. And I see it as a good investment for the patients as well, because reduce the cost of initially going to the hospital and having a long waiting line. So our long-term horizon, we are looking at the horizon where we could have lots of clinics using this. We could collaborate as well with international uh, organizations. We could put this in other markets, be it in Europe, and collaborate with other European organizations. So we are not only looking this in the short term, we are looking at this at the long term. We are looking at this at a place where this could become like a finance application. It could we could collaborate with other insurance funds, where the users are able to save. They're even able to have insurance premiums, such that in the future they are able to do these consultations freely, and be able to have even their treatment, go for their treatment freely, covered by their insurance plans. And all of these are all financial, they are all financial models we have in place.
Yeah, and you made mention of the waiting time, and I think is very important. And also when people understand that maybe sometimes they even go to the hospital and pay transport and not given the right service. I think with the app, it's already you already know, you are sure you're going to meet the right people, because it's already made known that this is the right person you're going to meet.
Yes,
So
yes.
you basically
We have
are
a
not
new
going to
listener.
pay.
I don't know if the listener can type on the chat so we can know where you are and where you're coming from. There's a new list. Okay, the listener just left. We're streaming on video, and most people don't have enough data. Yeah, go ahead. Sorry for the interruption. Go ahead.
Yeah, like I was saying, so, yeah, so I see more of the positive side, you know, and people always have this problem of even the choice of healthcare, which they have to offer their services. So basically, if you would scrutinize the trend of people on the app, it even gives them more confidence on who they are going to meet. So it's it's already a positive aspect in that area.
Yes, yes, because they have the ratings of the doctors and the clinics will be there based on how the feedback that the clients, the patients are giving. So you are right in that fact for sure.
Yeah, so I think the ratings will give the reality on the ground and not based on just people not knowing whether they're doing the right thing or not.
Yes,
Yeah, so
yes, that's true.
so basically, just to add to what you already said, I think that is a great application from the Philippa and everything, and given to what you said at the beginning that the people who are being put in place are going to be professionals. Means that they're going to be scrutinized. It's not about just about seeing anybody who is just called as per se a doctor, and I think it's okay that like from what I've gotten from the application.
Yes, yes, that's true. That's true.
So in that, I still have this one last question after saying all that. In that, how do you see the future of AI in the healthcare industry? Do you see it adding more jobs or reducing jobs? And what do you think between the private and the public sector in healthcare?
Okay, so thanks for the question. Regarding the effect of AI in the healthcare industry, I'll just repeat since the volume is low. We try to increase it, but no success. So I see AI like facilitating things, and if we're looking at the public sector where everything is fair, we can see it improving efficiency and output, and increasing efficiency and output means there are new jobs that are going to be created. There are new jobs that are going to be created, and the current employees will become more efficient. The current employees will be forced to become more efficient. So, looking at this being said, I think in a stable structure, if we're looking at where there's a level playing field, be it in Europe or in Africa, then AI should enhance output because people are always getting sick. I think people are getting sick. The curve of people that are get falling ill, I think it is a steady rise. But I think AI as well could be able to improve research and improve health, such that for the curve of people getting sick going up, it could remain stable. And there will be other. I think there will be other therapies. There will be other kinds of jobs that are going to replace like the healthcare, because now what we have are people going to the hospital when they are already sick. But when it comes to healthcare, there's actually preventive measures, and already there are measures taken when the person is already ill. But I think AI is increasing the access to information, which implies that preventive measures are going to go up. So I don't see it replacing jobs. I see it creating different kinds of jobs. The jobs only be replaced in a case where the current employees are not adapting. And still, in addition to that, I see. I think that in a level playing field, the jobs are remain secure. But as we all know, if it is in a field where there is not a level playing field, if it's an industry or a company where decisions are made unfairly, or it's a kind of private sector where maybe decisions are made based on how people slept the previous night, or depending on how their dog barked. I told you the story about the dog and how I once had a job just because the dog, I went for an interview because the dog loved me, I had the job. So in the private sector, it's about how the leader feels. But at the end of the day, we're living in a real world where there's a real creator that exists, and there's an equilibrium that is able to filter out the bullshit to the reality. So this equilibrium in the real world is able to ensure that there's extra efficiency, and it's just like how there's this, forces of supply and demand, and they talk about the free economy, where the forces of demand and supply regulate the price. So I believe that in the world, there's the forces of reality and bullshit that actually regulate the forces. There are forces of reality that regulate bullshit, and so that only efficiency actually strives. So I don't know if that answers your questions.
Yeah, I think answer the question, but I wish I think you actually answered it well, but I still have a little bit of this worry, which it has to be in a structured economy. Because yes, it's easier to just say maybe AI just comes and people it's not going to reduce the people's jobs. But let's look at it in this way, in AI and people adapting are two loopholes. You realize that these are things that people had not had before. So it's coming. So you need to make these people transcend from the normal way of doing things into using AI. And okay, like I can give an example. In the past, before computers came into existence, if you look at like that, it means that when the computer came, some people who did not know about the computer had to lost their job somehow. But those who now adapted faster, I know that people that have on to change, they don't want to change. They always want to remain on the same skill. So I think that even at that, I'm not saying that AI is a bad problem. We need to start solving the problem. We only need people to understand that it can be more efficient with the AI that is being introduced. And like I said, that transition is not always easy, but it's always better off to make them adapt to it and see how the move from that part of maybe thinking that it's going to reduce their job to maybe adapting better off to have a better job. Even better pay, why not?
Yeah.
You see, the change also should come with if I got years ago, they are going, I think as but in that light to make it a better solution, maybe maybe make them adapt and then maybe also increase the pay to make it more efficient.
Okay. If I get you correctly, you're saying AI. We need to Then there has to be training and sensitization so that people can be able to adopt change, and able to use new
Yes.
things. Yes. So
Yes.
yes, I was having a discussion with a friend, and he was saying yes, people need like 100 years before they'll be able to adapt. As I said, the principle still remains: bullshit automatically gets filtered out with time. And
Yeah.
regardless of whether people want to adopt something that is efficient or not, doesn't change the fact it's efficient. And whoever adopts that gets the result. If there's a product out that is designed to cure cancer, and you have cancer, you don't use the product, you're going to die, whether you like it or not, whether you're praying
Of
to your
course.
ancestors. It doesn't matter how you feel. If you
Of
have
course.
if you have a certain disease and you don't want to take the right treatment, regardless of what you say and think, it's going to kill you.
Yeah, so at the end, people should be able to adapt to positive change. That's another sensitization that people should need to understand.
Yes, even if they adapt or not, they are going to eventually adapt. It's just a matter of whether when they are going to adapt. So it's not like if they would like to adapt, because It's a two-sided thing. You either adapt and get the benefit, or you don't adapt and don't get the benefit. It's not compulsory, but it's available. It's not a
Of course.
requirement, but it's available. Like some people use bathing soap to bathe, while some others use savon, some others use what some people don't bathe at all. So it's all a choice. It's a
Yeah,
choice.
that's true. So you may mention more about the private sector, but I wanted to also know more about the public sector.
Yes, we are in partnership. We are looking at partnerships with the public sector as well. So we are looking at some projects that will eventually partner with the public sector and be able to implement this at a large scale. And God willing, if God blesses everything, we should be able to implement such a program and be able to have more impact.
Okay,
Yeah.
thank you very much. Uh, Idea of what you actually have for the application. I think is if everybody has to follow this process and if everybody is in this application and it follows the same things they have put in place, I think this is going to be a very much favorable application for not only Cameroon, I think, and for the world at large.
Yes, yes. Thank you very much, Dr. Chris. And it was nice talking with you. And I hope we can impact some people and put everything in the hands of God and have an amazing day.
Okay, thank you, and same to you.
Bye.